Hi,
थोड़ा
hello.
सा हम्म,
Sorry, madam. Yeah, we are
थोड़ा
live,
सा
madam.
ओके फाइन.
Yeah. Welcome, Dr. Purnima ji. Hi, hello, everyone. Good evening. We have a very, very senior obstetrician, gynecologist, and infertility expert today with us. Yeah. Today we have Dr. Purnima Nadkarni ji is with us. Purnima Nadkarni ji is a very senior doctor. She's one of the finest obstetricians and gynecologists of our country. She's the director of Nadkarni Group of Hospitals. Just we are talking that Purnima ji can speak 8 languages. So maybe you can write in your mother tongue and Purnima ji may reply in your mother tongue itself. And she's a marathon runner. Today morning itself, she ran 8 kilometers and she is behind 11,000 ICSI pregnancies and 3,500 IUI pregnancies. So today we have expert with decades of experience. She has been the best consultant of the whole Gujarat, and of course she's one of the finest doctors of the country. So she has been honored as a fellow in Indian College of Obstetricians and Gynecologists by Foxy. She's also a very, very active member of Foxy. Madam, we are very, very fortunate to have you with us today. So for the first 10 minutes, Purnima ji will talk about on the topic cesarean versus normal delivery, and she'll give us some important tips. I see so many questions for you, doctor, already. After the 10 minutes, she'll take all your questions live. So please post your questions in the comment section. Those who are watching in the iMumz app, please post inside the chat screen in the iMumz app, and Dr. Purnima ji will take your questions. Over to you, madam.
Good evening, friends. I am Dr. Purnima Nadkarni, Director of Nadkarni Group of Hospitals. We have got 6 hospitals and 4 IVF centers in Surat. There are 2 hospitals. One is 21st Century Hospital and the Nimaya Women's Hospital. Then we have got Killa Pardi, a small place in South Gujarat, which is 35-year-old, and we got test tube baby. We have given more than 15,000 babies from here only. And we have got in Valsad in Vapi 2 hospitals, 21st Century. I'm in practice obstetrician as an obstetrician for last 35 years and as a IVF specialist for 25 years. Now with that, let us start. Let me tell you what is a normal delivery and what is a cesarean, and then I'll tell you the difference between two. Normal delivery, usually 90% of the patient undergo normal delivery. Now, usually 90% when the baby is 9 months, the uterus is such a big, and baby is with the head down. When it's a head down, we call it a vertex presentation. A young patient who has got adequate height, has got adequate pelvis, because through the pelvis, the normal delivery comes through the vagina. You know uterus and you know vagina. You have sex through that same place, the baby comes out. Okay. So vagina should be adequate. For that, pelvis should be adequate. Height should be adequate. You should be younger patient and everything okay with you. Then when the head is down, initially in 9th month, what happens? First, there is something like a show. Show means you get little watery discharge, little blood stain discharge. You start getting backache. You get stretching. Your uterus starts contracting. First, once in 20 minutes, then once in 10 minutes, then 2 to 3 contractions in 10 minutes. That is a stage 2. So by that time, head gets engaged. Engage is the pelvic girdle. The head goes inside. Now head may go in this direction, in that direction. It's called right occipito anterior, right occipito posterior, left, etc. Don't worry about that. Once it goes inside, then it turns, okay? And then it comes out. So this is what happens. There's engagement, then there's a rotation, and there's a externally, head comes out. 90% of the cases, if everything is fine, women deliver normally. For that, she should have vertex presentation, younger patient, adequate pelvis, and she should not have any diseases like hypertension, heart disease, diabetes, cardiac disease, kidney disease, etc. Now, 50 years ago, we used to have our grandparents, grandma must have had 8 to 10 deliveries. Out of 10 deliveries, maybe 2 to 3 die in delivery process, but there are 6, 7 remaining, so it was never a problem. What is today? Today our women are educated. Many of them are professional, many of them are working, they have their passions to go follow. Some are dancers, some are artists, some are working like doctors, maybe school teachers, etc., bankers, etc. So we nowadays have only one or maybe two. I've not heard of a third baby in this era. So, what is important? Baby and mother both should be alive and fine. That is the funda today. Today we don't have 10 deliveries out of 3 gaya to gaya, 7 bach gaya. No. We have one or we may have two, but they should be, mother should be normal and baby should be normal. That is a funda. That is why rates of cesareans have gone up. Now let me tell you who is the one who requires cesarean. First of all, let us see the baby part. Now, baby sometimes is a preterm baby. We do a lot of IVF. In IVF, we got twins, we got triplets, and then in 7th month or something, the water bag bursts and there's a leak. So maybe at 20 weeks, 28 weeks, 30 weeks, that is 7 months, 7.5 months, sometimes 8 months. Now, this is a preterm baby. She cannot tolerate, this baby cannot tolerate the process of full going inside the pelvis, the pressure on the brain. There may be intracranial hemorrhage. That is why preterm babies leaking, there's no water, you might require a cesarean to save the baby, because you can take it out and neonatologist put you in NICU and baby does well. And this baby, if you make her deliver normally, give her bottles and pains, because the pains are not there, only water is burst. So if you get pain, the baby has to go through that process, sometimes even one day, because body is not ready for 28, 30 weeker delivery. And so in that, baby may get injured. So you require cesarean. Second, they may be baby may be having a different position. It may be transverse lie. The baby has to come with head. But if it is ulta, that is breech presentation, head up and bumps down. So that's breech. Sometimes small bumps they come out, but the head gets stuck and baby can die in normal delivery. So in such case, we do cesarean. Sometimes it's a transverse line. Head here, legs here, or head here, legs here. You cannot have a normal delivery when you have to do cesarean. So this is a position. Now, position of placenta. Placenta means when the baby delivers, what is baby getting? The umbilical cord, and there's a placenta which gives blood supply to the baby. Sometimes placenta gets separated because of hemorrhage, separated because of preeclampsia, or it's known as a hypertension. So placenta gets separated, there's a bleeding, you have to save the mother, save the baby, you have to do cesarean section. Sometimes placenta is down, which is known as placenta previa. Normally, the baby is there and then placenta is there. But sometimes placenta is down and baby is up. Baby may be transverse because of placenta previa. As such patients, 8th or 9th month, they start suddenly bleeding. You have to save the mother, save the baby by doing a cesarean section. This is about placenta. Sometimes water content, amniotic fluid, that is very less. It's known as a oligohydramnios. In such case, when water is very less and you come across the position where the fetus is having a problem, it's known in our term, it's known as a fetal distress. So fetus is passing stools inside. It's known as a fetal distress. In such case, we might have to do cesarean section. Last but not least is CPD is baby's head is big and mother is very short mother. So her pelvis is very small, or she is having a male type pelvis. It's known as an android type pelvis. So head goes inside but gets stuck, cannot rotate. In normal delivery, sometimes it's a borderline. We apply vacuum, turn it, take it out, or we apply forceps and take it out. We give a big cut in the vagina, that's a in the perineum, it's known as an episiotomy, and then deliver the baby. But sometimes it just gets stuck deep transverse arrest, we have to do cesarean. So mother is short or mother is having male type android type pelvis, such babies also, even though with head down, may require cesarean. And last but not least, the mother is having some diseases like diabetes, hypertension, severe hypertension. Pregnancy induced hypertension is known as PIH. Some females in the first pregnancy suddenly develop blood pressure in 7th month. They start getting legs start swelling, and there's a urine shows albumin, and they start getting dizziness, and they sometimes throw convulsions. In that, to save the mother as well as save the baby, you might have to do cesarean. So friends, these are the few indications. Even in heart disease, sometimes she's a heart patient. She's got mitral valve prolapse, or she has got some valve exchange operation has been done. She cannot push. She cannot push. In normal delivery, you have to push, push, push. Once the baby is, when the cervix is dilated, you have to push the baby, and her heart doesn't allow her to do that. In such case, you might have to do a cesarean section. So there are indications for baby and indications for mother for cesarean section. Cesarean section is given by giving spinal anesthesia or general anesthesia, and usually 90% of the cases nothing wrong goes out, but there are complications. There are complications of normal delivery, there are complications of cesarean. Postpartum hemorrhage is the number one killer in India. And postpartum hemorrhage happens to the patients who are anemic. So that is why taking 9 months iron, calcium, and doing good exercise, good nutritional diet is very important, because you have to prepare for the day. You never know, you might have postpartum hemorrhage. Now, postpartum hemorrhage may be traumatic or may be atonic. Atonic means the uterus, once the baby is out, the placenta is out, uterus should contract. It contracts, so all the vessels, they stop bleeding, and within 5 to 10 minutes everything stops. But sometimes it just doesn't contract, it just remains relaxed, and the bleeding and bleeding, and it is known as a atonic PPH. It can happen in normal delivery, it can happen in cesarean section. So it is a worst complication is postpartum hemorrhage. Second complication in cesarean can be because of anesthesia, total anesthesia. You give a spinal and whole breathing stops. That is anesthetic complication. Third complication can be the baby is delivered and the water bursts. Suddenly the water, which is known as a amniotic fluid, suddenly goes into the vessel and into the heart. It's known as a pulmonary embolism. This can happen in cesarean. It can happen in normal delivery also. Patient have delivered and suddenly she's gone gasping. She starts gasping. The froth comes from here and she dies. This can happen. So friends, normal delivery or cesarean. I'm from Maharashtra. I'm Konkani. They used to always say, my mother used to say, delivery is a punarjanma. It's a new life. Really, it's a punarjanma of a mother. So, friends, just now I told you what is normal delivery and what is cesarean section, and definitely delivery is a new life. Okay, so I am here to take your questions.
Thank you so much, doctor. That was very beautifully
Yes.
described. So we have questions, so many questions already. The first question we take from the handle Lal Tomato. She's asking, "Hello, doctor. I hope you're fine. My question is, vomiting. Is it a good sign of pregnancy? Because I have no vomiting still. Yet still I am 7 weeks pregnant, and the
Oh wow.
ultrasound, the gestational sac is 1.87 centimeters."
Perfect. No, lal tomato, it's not that you should vomit. Vomiting happens in the first pregnancy. To 70% of the women, 30% of them do not have vomiting, and it's a good sign that you do not vomit. If you vomit, then your husband is tired of you, mother-in-law is tired of you, you are tired of yourself. It's better that you don't vomit. You're very lucky girl.
She also mentioned the yolk sac is zero
Second
point
question.
0.4 centimeters. Is it normal? Same handle. She asked,
Uh,
the yolk sac is zero point 0.4 centimeters. Is it normal? And she's feeling.
For
Sorry.
more yolk sac, 0.4 centimeter is little more than normal. It should be 3 by before 9 weeks. It should be 3, but maybe doctor must have taken it little bigger. So don't worry. Everything else is normal. So don't worry. You have flu and sneezing. Is it harm my baby when I sneeze? No, no, not at all. Your baby is not going to drop when you sneeze. Nothing will happen. But definitely, show to your gynec and take your medicine for flu and sneeze and take care.
Thank you, madam. Dr. Jaideep Malhotra ji is welcoming you.
Yeah.
Wonderful to have you for this session. It's really wonderful to have you in the session with.
Yeah. Thank you, Jaideep. Thank you, Jaideep.
Next question we have from Kiran Modi. She's 7 weeks pregnant. She asked this inside the iMumz app. Her B12 level is low, that is 175. How will affect her baby growth? Can she increase her B12 levels?
Her beat is 75 or 175, she said.
B12 level chasing.
Acha, B12 level is 75. It's very, very low.
175.
Definitely.
175.
Still, it is low. So, if you're not vomiting, doctor will give you B12 tablets or one injection of B12 every week, one injection of 2500 micrograms you can take. Four injections also you take, it will be very good because B12 is very much needed for the brain development of your baby. So, you can consult your gynec and take B12 injection once a week, four injections will be okay.
Yeah. Thank you so much, doctor. So all the best, Kiran. Next question is from we are from Menaga SV. She have a BMI of 29 and she's
Hmm.
worried will it be a problem for the normal delivery. She has
Uh,
been active her entire life, but slightly overweight for the last few years due to the work style. Also
hmm.
severe tailbone pain from the last week, and she's 24th week pregnant.
See, right now you are already pregnant, but you are still 29 to 30 years. You are pretty young. You are 24 weeks pregnant and your weight is little high. Be careful. See, you can, now onwards, you can control your weight. See, don't have oily food. Don't have butter, ghee, things like that. Take a little lesser rice, more of proteins and less of rice you can have so that your weight doesn't improve. Don't take more than two bananas a day and don't take fatty food like you people are fond of aloo paratha and all, so don't have a lot of alus, you'll become like a aloo. So you remember that carbs and fats you reduce in your diet, so you'll be happy. Have lots of salads, lots of fruits, you can have milk, no problem. You can have toned milk, not the whole milk, means not the heavy milk. You can remove the cream and then have the milk. Have lots of buttermilk, that's very, very good because it's a probiotic. And soups and salads you take, and reduce your rice intake. Have more of proteins. Rice intake reduced and fat intake reduced, you'll be okay, don't worry. And iron, calcium you take properly.
Thank you, doctor.
Thank you,
She's
lal
trying.
tomato.
Yeah. Next question we have from Supraj Ojha. Hi, my first baby delivered with C-section, horizontal wise due to amniotic fluid level 9.5. After 4.5 years, I'm 14 weeks pregnant now. Is that vaginal birth possible for the second one?
Very much, Supraja. Vaginal birth, 80% it is possible that you will deliver vaginally. If you got a good height and good pelvis and your baby is in the head down position, the doctor will definitely deliver you normally. And don't worry, but do continue now. There is lockdown. When the lockdown goes up, you have a good diet and exercise, routine exercises, and yoga, pranayama, everything, and you will definitely last month you start bending exercises and squatting exercises, your baby will go down and you'll have a normal delivery, don't worry. So 80% you'll have normal delivery. 20% if the baby again has any problem, as I told you, maybe transverse line, maybe breech presentation, placenta down, or again waterless, then you doctor may repeat.
Thank you, doctor. Next question we have from Rishi
हाँ
Kumar.
थी
Hi,
लेकिन
ma'am.
मिस्ड अबॉर्शन आया जो 2 दिन पहले ही हुआ है। अब मेरा पेट में नीचे के हिस्से में दर्द होता है। बेटा ऋषि कुमार, इट्स वेरी सैड दैट 2 days ago it has been diagnosed as missed abortion. When it is a 10 weeks missed abortion, you go to the gynecologist, she'll give you some medicine, you'll get pain and she'll do a suction evacuation. It's known as curating बोलते हैं आपकी भाषा में। आपको डॉक्टर के पास जाके क्यूरेटिंग करना है, क्योंकि जब भी बच्चा मर जाता है पेट में तो भगवान बोलता है जा डॉक्टर के पास, नहीं तो मैं निकालूंगा। सो पेन इज बिकॉज once the baby is dead, within 3 to 4 days it starts throwing the baby, so suddenly it'll start bleeding. So it's better that you go to the doctor and get it cleaned and see your blood group. Confirm your blood group and tell the doctor what your blood group is. आया या क्या, मुझे 10 weeks प्रेगनेंसी लेकिन क्रिया अबॉर्शन आया जो 2 दिन पहले ही हुआ। अब मेरे पेट में नीचे के दर्द हो गया। हाँ, मैंने बता दिया। आई हैव आंसर्ड यू। आंसर्ड ऋषि ऋषि कुमार, आई हैव आंसर्ड यू। हेलो तेजा, नेक्स्ट क्वेश्चन प्लीज। Hello. Next question, please. Ravi. Hello. Hello. Next question, please. Rishi, could you hear me?
ನೀವು ಕರೆ ಮಾಡುತ್ತಿದ್ದ ವ್ಯಕ್ತಿಯು ನಿಮ್ಮ ಕರೆಯನ್ನು
Hello. हाँ रवि, any problem?
So sorry madam, यहाँ पे कुछ टेक्निकल इशू था. Can you please join again? It's fine now.
हाँ, I'm there. I'm on. मुझे कुछ करना
you're
पड़ेगा
not-
वापस?
I'm not able to see you. That's it.
तो
Okay,
मुझे
madam.
क्या करना पड़ेगा? कुछ करना पड़ेगा वापस?
आप वापस ज्वाइन कर सकते. हाँ.
So sorry,
Hello.
everyone. Yeah. So sorry, madam. So sorry, the viewers. So sorry for the small technical glitch. Rishi Kumar's question is over. The next question we take from Suman Kanwar.
हाँ. Hello doctor, important 19 August. May I coffee sometimes? I am not having it as it hampers the absorption of iron. Yeah, but too much coffee is not good. But you can have 1 or 2 cups of coffee per day, and iron you can have at night. So coffee early morning you are taking and coffee afternoon you are taking. If you have iron at night, it will be nicely absorbed in 6 hours. So no problem. You can have 2 cups of coffees per day, no problem. Because I'm a South Indian, I have to have coffee. I always had coffee and I had lovely children, so don't worry.
Same pins,
Preeti, my
doctor.
periods
Next
have been
question we
late
have from
for
Nishal.
1 week and I am currently has infection. Nishul, you are, just do your urine examination, urine pregnancy test and urine examination as well. If you are pregnant, only you do pregnancy test. Initial only at one vaginal pessary can be given to you, Fentozac vaginal pessary, and you can use candid vaginal cream you can apply. You'll be okay. It is safe for even though you are pregnant. No worry. Local treatment is fine with you. And do pregnancy test.
Thank you so much, doctor. Next question is from Preeti Kakade. She asked this question inside the iMumz app. Hello, ma'am. I had gone through fibroids operation last year. Now I'm 7 weeks pregnant, conceived naturally. In my 5-week sonography, yolk sac was visual, but only one fibroid also seen. Is it normal?
Yeah, there may be some small fibroids inside. Doctor must have removed whichever was seen from outside. There must be one small intramural fibroid inside which remained, which will grow with your pregnancy, but nothing wrong will happen to you. And it's nicely 1 year has passed, so the problem of rupture also is very, very minimal. But remember, when you have a fibroid, I do not know how it is removed. If it was a big fibroid and it was cut open and your cutting has gone up to the endometrial lining, very rarely there is a 0.1 chance of a rupture in later part of pregnancy. So you should be always careful. Go to your gynec regularly and tell her that I have been operated for myoma. That's all. And this myoma is not coming in your way. Forget it.
Thank you so much, doctor. Anamika Mishra is
Anamika's
on the screen.
mouth of my uterus was not open at all, so doctor suggested C-section. Is it necessary or should I wait for my due date? See, Anamika Mishra, first of all, if you are young and you got a good height and your pelvis is adequate, you can wait. You can wait for another 5 to 7 days till you are 38 weeks and 10 days maximum you have. If water content is all right and your Doppler does not show, fetal Doppler does not show any problems, and water is adequate, then continue doing exercises very nicely. Keep a watch on your fetal movement chart, and fetus is moving very well morning, evening. 1 hour you see. If it is in 1 hour morning and 1 hour evening, you keep a chart. 10 to 15 times it moves, 10 to 15 times it moves. You go to the gynec says NST is non-stress test they do. If NST is normal or ultrasound, if the gynec does an ultrasound and shows a fetal umbilical vein, everything is normal, the Doppler is normal, then you can wait for another 10 days. Do good exercises. By that time, the uterus will come down and cervix will come in the position which is natural. You can wait. And if you have got previous delivery, you can always wait.
Thank you, Doctor.
Thank you, Supra.
Yeah. Next question we have from Anamika. Another Anamika asked this question inside the iMumz app. Hi, Doctor. I got done my level 2 ultrasound 3 days back. There is an echogenic focus observed in the left ventricle. Is it something that can pose serious health risks to the baby?
Is it in left ventricle or right ventricle?
Left ventricle.
Maybe. I think it's maybe in the right ventricle, but not to worry at all, because if there is any problem with the baby, it comes in a double marker test, it comes in a quadruple marker test, and this is a very, very minor. This will go away. Maybe another 15-20 days, it may not be seen. So don't worry. Don't worry. Shweta Rajendra, I am 7 weeks pregnant. In my first scan, doc told me amniotic fluid is less than normal. Please suggest me. Shweta, I do not know your age and I do not know how you become pregnant. If you have become naturally pregnant, doctor should give you tablet Delispin, aspirin, aspirin 75, baby aspirin. It is 75 milligram tablets you take, drink a lot of water and take antioxidant like arginine, etc. There are sachets available, Argiva. Take that, take aspirin, take folic acid properly, take adequate water and wait. After 10 to 15 days, repeat scan will show adequate water.
Yeah. Thank you, Doctor. Next question we have from Renuka Sharma inside the iMumz app. Hello, ma'am. My protein level is little low. Please suggest vegetarian food which I can take to cover this deficiency.
What weeks of pregnancy you are? Can I get to know?
20th week of pregnancy. Renuka is.
How many weeks?
20th.
20th. A vegetarian food protein is, one is a protein powder which doctor will write to you, so you take that. Milk is a very good protein. Curds are good proteins, and then all the pulses, watana, chana, all sprouted pulses are very good. And chana shengdana, jo bhaiya wala hota hai na, buna hua, that is good. And you can have, if you are affording, then kaju, badam, pista. These are the good source of proteins for vegetarians. Punam Shinde, I am 24th week. Placenta maturity grade 2. Is it normal? Should I take extra precaution? See, grade 2 placenta is a little calcified placenta. So you have to be very, very much careful. A doctor can give you spam. If I get such patient, because I'm a IVF specialist, so I'm little taking extra precautions. I will start aspirin for her. I may start low molecular weight heparin. That is a shot to be taken every day, low molecular weight heparin. So we give a shot every day so that the blood supply to, it indicates that the placenta is getting thrombosis. The blood vessels are thrombosing, and that is why blood supply to the baby may be reduced. Sometimes it is seen in the torch infection, Toxoplasma rubella. So sometimes I give tablet rhomycin to my patient for at least a month, one morning, one evening rhomycin. You can discuss this with your gynec and she will treat you. You can do walking, no problem. Alka, hello ma'am, I had under ERA in the month of Feb. Since then, I did not get my period. So you did your ERA test and you did not get your period. Go and get your pregnancy test done. If it is negative, it will come. Doctor might have given you OC pill or maybe Primolute and or something because of that.
So Ayla, she tried IVF, but that was unsuccessful.
Yeah. Wait for the ERA test results, because ERA test result will take at least 3 weeks to 1 month. And now I don't think in lockdown it will come for another 1 or 2 months. You do your pregnancy test. And if pregnancy test is negative, get your ultrasound done. There may be ovarian cyst or something, which doctor will give you, then progesterone withdrawal. Vibhuti Gupta, hello doctor, I'm 34 weeks with high blood pressure. How does high BP affect pregnancy? High blood pressure has effect on normal pregnancy. Yes, high blood pressure is never good, but it is not in your hands, because in when first pregnancy, it can happen naturally. To 20% of the women do get it. Now, do your salt restriction. Take less salt. Don't take salt. Take salt only in dal and sabji. Don't take in rice and chapati and things like that. Salads maybe salt mat lena. So salt restriction you do. You do good exercises. Yoga, pranayam. Now in lockdown, I can't tell you to run. Sit at home, do yoga, pranayam, and meditation. Everywhere, take less salt in everything, and then take BP tablets as your lobetalol is one tablet which doctor will prescribe you. Take that properly. Now it does affect, yes, when the BP of mother is high, blood supply to the baby goes less, and that is why sometimes amniotic fluid content goes down, baby's growth goes down, and very rarely, if it is not controlled and it goes up, you sometimes get dizzy, you get chakkar, you get dizzy, and you may get convulsions. So BP is not good at all, but fine, 34 weeks. Now another 2 weeks, 2 to 3 weeks, and you'll be doctor will deliver you. Okay, so take care. Ravi Kumar. Till what time enoxaparin injection will be taken? Is it harmful? See, first of all, enoxaparin is not harmful to the baby. It's a low molecular weight heparin, and you can take it. We usually give it. We stop it 48 hours before delivery. 48 hours prior to delivery. Okay.
Yeah. The next question we have from Priyanka.
31 weeks pregnant, I have swelling and vaginal bone pain. What can I do? Get rid of swelling. See, vaginal bone pain, you can have it because it's a pelvic girdle, pelvic girdle, anterior part of the pelvis, the bone becomes thin, softer, and it goes away, so that it makes baby come down. And that is why you must be having that vaginal bone pain. You can apply, if it is external, you can see it, ovarian gel you can apply 2-3 days. You can take one tablet, Dolo 650 milligram is a painkiller. You can take that. You will feel good. And you apply this Voviran gel. And getting rid of swelling. See, you sleep in left lateral position, and keep a cushion below your legs and take your legs up. So in the afternoon, 2 to 3 hours when you sleep, left lateral position, keep a cushion below your legs, and your edema will go down. In the night also sleep in that position. Yeah, and sometimes protein content is less, so take a good protein in your diet. It can be there are many protein powders for moms. Take protein powders. You can have eggs also, milk also properly. The edema will go back. If you don't have a BP, not to worry. It is naturally happening in left legs more. It is because of hypoproteinemia. Most of you are vegetarians, so protein content less, so it can happen. Third, it can happen because of hypertension. So these three things to be taken care. Vibhuti, thank you.
Next question is from Navya Madam. She asked this inside the iMumz app. She's asking, "Hi doctor, I was detected mild fibroids in 6th week of pregnancy, and doctor has put me on Miprogen capsules medication. Now she's in 22nd week of pregnancy, still using Miprogen along with other supplements. And will there be any obstacles for the normal delivery?" It's her question number one. And her question number two, she is practicing basic yoga. Is it fine to do workouts 4 days per week? It's question number
Very
two.
nice. Yeah, you are doing a very good job. Continue doing yoga, no problem. About fibroids, mild fibroids, they do not come in the way unless the fibroid is low down, just behind the bladder. You have a bladder, you got a uterus, and you got a rectum. If posteriorly cervical fibroid or anterior cervical fibroid, that comes in the way of delivery, then you have to have a cesarean delivery only. But if it is up anywhere, it doesn't come in the way. Very rarely, when fibroid grows with the baby, there is something known as a red degeneration. In that, there is a severe pain in abdomen, and you have to get admitted. So red degeneration is a blood suddenly there's a blood clot inside that fibroid. So this is a very rare thing, but this can happen. But in that, doctor will keep you in the hospital. She'll give you painkiller and she'll give you uterine relaxant, and within 3 to 4 days you'll be okay. So don't worry.
Actually,
No,
she
no, no,
has
I'm
another
lagging it, but
question.
I
Now,
can't feel my baby move. Another 10 days and it will move. 21 weeks it will move. If you are having a first primey, your baby moves on 20 to 22nd week. So wait for 10 more days and it will move. And just relax and concentrate. It is moving, but you cannot know it because you are a primey. You are first time becoming mother. That is why another 10 days, just 10 more days, it will move. Don't worry. Drink a lot of water, it will move.
thank you so much, madam. Actually, Navya has another question. She's asking, she's having vaginal pain and backache near the joint since 22 week. What could be the reason and what measures should be taken?
I just told one of them had asked me that joints become loose to allow the baby to go down. So you can apply Voveran gel or you take tablet Dolo. You should take vitamin D. It's very much important during pregnancy. Taking doctor, your gynec will prescribe you vitamin D. If she does not, you just remind her to give. So one tablet per week for 10 weeks you can take this. So don't worry. This is a treatment. When should gestational diabetes test? When should diabetes test? Currently, your gestational diabetes test should be done right now. 26 weeks, your doctor will do right now. She'll do after every 1 month. She should repeat. And this is done empty stomach. Your sugar will be done. Then 75 grams glucose will be given to you. And after 2 hours, they'll check your blood sugar. And if it is more than 140, it is gestational diabetes. Okay. Sonal. I am 21 weeks and weight 96 kg pre-pregnancy. I was 93. How can I increase chance of natural delivery? You forget natural delivery at 96 weeks pregnancy. Of course, I'm just teasing you. May or may not, but you try to control. As I answered someone else who was saying her weight was more. So no fats and very less carbs you take. No potatoes. Take only little rice. More of proteins, lots of you can have fish, you can have lots, green salad you can have lots of vegetable fruits, and a lot of milk you can have, and curds you can have, and rest all soups and salads if you keep, and less of Niharika, and less of fats in your diet, no oil, no ghee, and you can try to control your weight, then and do and exercises. You may have a normal delivery, but I would say 20% normal, 80% scissor. Because of your weight, you may develop gestational diabetes, you may develop preeclampsia, and your baby may not get more of blood supply, and that is why water content will be less. In that case, doctor will advise you cesarean section. Hello, doctor. Kavya. Hello, doctor. Not in NT scan. Not done with NT in these corona condition. Is it okay to skip NT scan now? I'm 13. So don't worry. Next week it will open. Next week if it opens, you go and get it done. And if it's not done, they will do your directly quadruple marker test, and doctor will see you. Don't worry. Targeted sonography will be done at 20 weeks. For any patients, 95 to 96 of the patients percent of the patient, everything is normal. It's only 4% which is abnormal. If you have previous history of previous pregnancy having abnormal, or your cousins or someone in the family having abnormal child, then you should worry more. Now you just do not worry. Next week everything is opening up, so you can go and get it done. Sangeeta, hello doctor. My name is Sangeeta, 33 years. I want to know the exercise for pre-pregnancy, also diet plan. Yeah, very nice. The exercise for pre-pregnancy, whatever you like, I'm a marathon runner. I am 65, but still, today morning I did 8. I do 8 kilometers, 7 kilometers, 6 kilometers. Even in COVID days, our house is very big, 1 acre land. So we run. All of us run in the morning. So do that. Running, if you wish, that you do. If you don't want to, swimming is another good exercise. Skipping is exercise, and then cycling. These are 4 very active exercises, I would say. You young girls, you can do Zumba. You're dancers, I just really wish I could do Zumba, but my joints pain when I do a lot of dancing. So Zumba and dancing, these are exercises you can do. Then second is if you are not very much active types, then you can do yoga, pranayam, but diet is a must for you. And if you maintain your BMI, body mass index, less than 30, plan your pregnancy. Ketki, 20 weeks pregnant, not having iron, calcium for so long, still really fed up with the metallic test of the month. I know, Ketki, even I had a problem. I could not take. But what you do know, how you take, I'll tell you. Don't put it in the tap. Just take water in your mouth. Pani dalo. One iron, hut karke fek do. It just goes, gulp it with the water. Metallic test will not come, and you take it at night. तो सो जाने का और कैल्शियम मॉर्निंग में लेने का डन you must नहीं तो बच्चा you will become anemic and your anemia will go to your baby also. This actually I saw many video in YouTube, but which one is good to follow? It's confused. Better you suggest no, I'm not a YouTuber at all. I can't tell you. You better meet me and then I'll tell you. I'm not a YouTuber. That I think Dr. Jaideep Malhotra, Niharika, you can ask when they are there next time. I am not a YouTube person at all.
Yeah. So Sangeeta, which topic are you actually wanting? Pre-pregnancy exercise and diet plan you want? Okay.
Yeah, diet. I told about the exercise and about diet. Any diet which is low in fats and low in carbs should be taken. Now, what is fats? Oil, butter, ghee is fat, and carbs is chawal, potato, sweet corn, and kand ani ratalu ani suran. These are carbs, and all the cereals like maize, the corn, all the cereals are carbs. So you take all these carbs less, oil very less, take more soups and more salads. You can have fruits, you can have milk without cream. You will be okay.
So Sangeeta and who are watching, everyone, iMumz is coming with pre-conception and post-delivery support very soon. So we want to support the delivered mothers as well as mothers who are planning to conceive. So you can see those in the iMumz app very soon. Next question is from Manish.
Central placenta previa and placenta previa. See, the placenta, this is the uterus. Okay? Placenta is supposed to be up and baby is supposed to be down. Fine. Now placenta goes down. There are various ways. There is a whole uterus. So placenta may be lower down 3 centimeter, just less than 3 centimeter away from internal os, then it is known as anterior placenta previa. If it is still further, it is touching the internal os. Internal os is a mouth of your cervix. Then it is known as a grade 2. When it is completely covering, it is this side and this side, and this is the mouth. Can you see this? This is a cervix. And complete, this is central placenta previa. Okay. So anterior placenta previa, grade 1, touching the internal os, grade 3, crossing the internal os on one side, grade 3, grade 2, grade 3, and completely in the center placenta on this side and this side, and it is in the center. That's known as central placenta previa. All are bad, but central is worst.
Thank you, doctor. Next question we have from Sri Lakshmi Manjunath. She is in 17th week of pregnancy and she's 24 years old. She is feeling comfortable to sleep only on the sides. Is it safe? Also, she is overweight. So please give us some tips for a natural delivery.
First of all, as I told you, the control, no fats, very low fats, and very, very low carbs. That is a diet. I just mentioned that. Routine exercise. Now, yoga, pranayam properly you do. And if you have a cycle, you can have gentle cycling at home if there's nothing giving problem to you. So you will be prepared. And you're 24. So as it is, you're a little obese, you can have a normal delivery. No worry at all. With a good exercise, and don't allow the weight to go up. What question else she's asked? Anything else you asked me?
Yeah, she asked, what are the tips to natural delivery? That's what she asked.
Yeah, natural delivery exercise, a good exercises, and maximum exercise from 28 weeks onwards.
Yeah. So Sri Lakshmi, you can follow the yoga section of iMumz as well. Next question we have from Nirali Shah. Hi ma'am, I'm in 7th week of pregnancy. When will I hear the baby's heartbeat? Doctor asked me to start sustain, but I feel this medicine is bit costly. So can I know when will I need to take it?
See, if you do not have any problems before, and this is a first pregnancy, you do not take sustain if it is very costly, you feel. You can avoid sustain. If there's any bleeding or something, pain or anything, then you start. So, folic acid you must take, and you will hear your baby only when you are 20 weeks, 5 months. The doctor will put some machine that's known as Doppler, book, it will come. And if you want to see it earlier, 12 to 16, 11 to 13 weeks, there is an anti-scan. Doctor will do an anti-scan, tell her to show the heart. And she'll show the heart and she'll put on, and she'll get a boop, boop, boop. You'll be able to listen to it. मैं 11 वीक्स की प्रेग्नेंट हूँ, मेरा कुछ खाने का मन नहीं करता, जो खाने का मन करता वो सब बोलते हैं कि नुकसान करे. कुछ भी दुनिया में नहीं है कि जो नुकसान करेगा. करेला खाना तो खाओ, वाल खाना तो खाओ, पापड़ी खाना तो खाओ, चटपटा खाना तो खाओ, पिज़्ज़ा खाना तो खाओ, पास्ता खाना खाओ, जो मन करता है खाओ, किसका सुना मत. ईट टू अवर्ली, बट नींबू का शरबत सॉल्ट और शुगर डाल के 3-4 बार पियोगी ना, शुगर जाएगा तो वॉमिट कम हो जाएगा आपके शरीर में. लस्सी लेना, दूध में थोड़ा सा हर्षली का डाल के पीना, कोल्ड कॉफ़ी लेना, ये तो कोल्ड चॉकलेट लेना, आपको अच्छा लगेगा. 2-2 घंटे में थोड़ा एक-एक फ्रूट खाना, तो वॉमिटिंग चला जाएगा, यू विल फील बेटर. जो अच्छा लगता है खाओ, किसी का सुना मत. Is it possible to have vaginal delivery without any tear, stitches in perineum? See, if you are first time, no, you will tear. If you are first time primary, it's always better to get doctor do your episiotomy. And if you will now insist that no, इतना बड़ा tear हो जाएगा. So episiotomy लोगा या तो gentle vacuum delivery या forceps delivery करेंगे तो आपको tear नहीं होगा. And pain associated scares. How to get mentally prepared for it? See, first of all, mind, yeah, you are very much right that the pain and everything, but you know, what is the aim? I want a normal baby. Just imagine a beautiful baby. May it be a boy, may it be a girl. Imagine a very beautiful baby in your eyes. Every day pray to God that God give me a normal baby. That's it. And when you are in labor, you know, it's a mother's feeling, you know. You are going to become mother. That excitement is always there. And that is why you bear the pain. See, I had 3 normal deliveries. First baby was 3.5 kg, second baby was 3.7 kg, and third baby was 4 kg. You understand? And I have gone to terrible. First time I didn't know when it was paining. I was a gynec resident. I was doing my internship, and I was delivering many patients. The 5th delivery, that was the 5th gravida. She was delivering. I'm talking the story of 40 years ago. So she said, "Madam, तुम्हाला दुखतंय, तुम्ही जाऊन झोपा." She told me, "You go and sleep. You are in labor pain." And I was in labor pain, little backache I was having, but I didn't know because I was working. The woman who works, the woman who exercises gets very less pain. And by the time I reached the hospital, I was fully dilated. The nurse told me, bear down. I said, doctor आने दो. वो बोलती, मैडम आप full dilated. बोलती, कैसे मैं full dilate हो सकती? मैं तो प्राइमी हूँ. बोलती, मैडम तुम्हें full dilate है, जोर करा. जोर किया, बच्चा आया, माँ नहीं, बाप नहीं, डॉक्टर ने कोई नहीं था. सोचो, ऐसा हो सकता है if you are exercising. I was exercising, tremendous exercises I used to do even that time. And I was working. So, mentally prepare हो जाना, काम करना और सोचना कि मैं माँ बन रही हूँ, सब पेन यूं चला जाएगा. Okay, Priyanka?
Yeah. Thank you so much for sharing your personal experience, madam. It's so beautiful to know all these things. So, Priyanka, we have a baby care program. So, in the 8th and 9th months, we have exercises, you know, which those exercises are proven. I mean, many women have shared that those exercises are, helpful for them to prepare mentally. Next question we have from Imran.
Hi, doctor. My wife is 15 weeks today. Her last protocol done last month and everything was normal. So now, every 2 weeks later, by 19th week, you should go. You should get her targeted sonography done. But before that, if you've not done a double marker test, she's not done because of the lockout. She should go for quadruple marker test. That is a blood test, and which will tell is there anything wrong with the baby. So next important is quadruple marker test. If double marker has not been done, or Immediately on 19th week to 20th week, you should go for targeted sonography. Doctor will see every part very nicely. It will take 40 minutes and tell you if there is anything wrong. Okay? Is it okay to miss checkup or should we consult another hospital? No need. If she doesn't have any problem, let her continue iron, calcium, folic acid. Don't go to any hospital unless there is any problem. And now within 8 to 10 days, the baby will start moving. And I think next week they will allow you to go. Next week, I think third. I don't think the lockdown may continue. In my place, it's a green zone, so we are working. We are working 24 hours.
Yeah. Thank you, doctor. Next question we have from Saida Fatima. She asked this inside the iMumz app. Hello, doctor. At 25-week ultrasound, OGTT normal, also TT injection given. Now I'm 31 week and due to lockdown, I couldn't visit doctor. Want to know if there is another dose of TT injection should be taken or
Yeah.
any other test I should do at 31st week.
So if you have
Or
taken
can
one
I wait till
injection,
lockdown?
you should take a second injection, tetanus toxoid. You must take a TT injection. And number two, when lockdown opens, you go to the doctor, but continue taking iron, calcium, folic acid, protein powder, and continue taking your good diet, milk and curds and milk and good fruits, vegetables. Eat 2 3 hourly, less of salt and less of sugar and less of oily things. Mega. I'm 7 weeks pregnant. I'm TSH level 4.8. Does it affect baby in any way? Yeah, 7 weeks pregnant. The TSH 4.8 is little more. 3.4 is a borderline we take. So doctor will give you a small dose, maybe 50 micrograms of TSH tablet should be taken because hypothyroidism does give a problem. You may have abortion, you may have bleeding, and complications of pregnancy may come with hypothyroidism. It's of course it's a borderline, not to worry, but take the hypothyroidism thyroxine doctor will give you. And even after delivery, sometimes the baby doesn't study so well, and baby may get thyroid goiter, etc. So it's better to take. Nancy, hi doc, I'm 25 weeks pregnant, having pain in my vaginal area. What should I worry? And can I get digest iron? Please both. See, first of all, vaginal area, if you get, there may be infection inside. So you can apply Candid V gel inside. Okay? And you'll feel better. Candid V. Should I have, can't have digest iron medicine, please? See, iron tablets, it's very difficult. But you take Levogen. Levogen is a very small, Levogen is a very small tablet. Take it at night and after full dinner, so you'll not have any problems. And calcium you take in the morning. And see how I told you, I cannot digest. Everything is digested. You can, मनुष्य खाएगी ना तो भी digest करेगी. Digestion हो जाता है. You take a glass of water, मुंह में रखो और गोली टक करके फेंको, अंदर जाएगी, सब digest हो जाएगा. But take one little small tablet. Of course, iron containing things I take. गुड़ और चना होता है, गुड़ होता है ना, गुड़ and चना, अपना भैया वाला चना भुना हुआ. So good chana you can have papaya, you can have this क्या बोलते हैं, beetroot, gajar and pumpkin. These are the giving iron giving and green leafy vegetables. उससे बहुत सारा iron मिलता है. So have that. But बेटा छोटा सा लिवोजन का टैबलेट टकाटक खा, बच्चे के लिए करना है कर लो. Hi Jaideep. Thank you Jaideep. हाँ. Linusha, hi ma'am, I'm 15 weeks pregnant. I'm taking Dimax tablets. I double vision and IIH in 10 weeks and now 80% recovered. Is it okay to have these tablets and can I have? No problem. You take Dimax. It doesn't have any side effects on your baby. You can Google it out or you can ask your even that eye surgeon. But Dimax is fine. You can have it. They will not have any problem with your baby. You're 80% recovered. Maybe they may stop it after a month or so. So you can have these tablets and you can have normal delivery. Don't worry.
Thank you, Dr. Kiran Modi asked this inside iMumz app. Her question is, should she take progesterone tablet till the 9th month? Will it have bad impact in the long run?
Progesterone tablets for you 28 to 30 weeks will be enough. After that, unless their cervical length is less or you're having an irritable uterus, you don't need it. 28 to 30 weeks should be fine. Akanksha, I am 5 weeks pregnant. What vitamins? No, don't take anything except folic acid. Only folic acid, Akanksha. It's too early to take anything. Folic acid and glucon D powder, that's enough. Kanchan, hello doctor, how are you? Hope all fine. Thanks for your lovely session in this. Thank you. Khushbu, hi doc, I'm 6 weeks pregnant. I was active and used to be exercise before conceiving. Can I continue yoga? See, you can do all the yoga, sitting, meditation, etc. Don't run and all. Don't run, don't swim, don't cycle right now till you cross 12th week. After you cross 12th week, you can have a brisk walking, etc. Right now, you can just slowly walk. 15 to 20 minutes in the morning, 20 minutes in the evening. If you're used to that, you can do that. But yoga is perfectly all right. Any position of yoga is fine.
Chandani Verma has a question. She's in 35 weeks of pregnancy. Yesterday, her doctor gave her injections for lung maturity. After that, she's feeling very less movements.
She's 36 weeks pregnancy. Any diabetes or anything you have?
Those details she didn't mention. She's 35 weeks pregnant.
Don't worry, that's psychological. Baby is moving less. On the contrary, doctor has given you that injection so that your baby becomes mature. Drink lot of water, it will move. Don't worry. Nothing. Steroids do not have any side effect on your baby unless you are a diabetic woman. If you're non-diabetic, you're not hypertensive, don't worry. It's just psychological कि इतना इंजेक्शन दिया मेरा बच्चा नहीं हिलता है, ऐसा नहीं हो सकता. बच्चा मैच्योर है, बच्चा अच्छा है, सब ठीक होना है. Hi, Pawan Kumar. Shilpa. Hello, ma'am. 26. My BP is 130/90. Is it normal or I do need take any medication on which digital BP monitoring machine is good? Digital BP monitoring, I do not know. I'm not into it. I take with my machines that you can find out from your doctor. I am not a digital BP. But 130/90 is a borderline, it's a mild preeclampsia. You're going for blood pressure. Now, first you do your urine examination. If urine shows urine albumin positive, you are sure shot candidate who will get blood pressure in the near future. So you do your salt restricted diet, do exercise properly. All your diet, you take even carbs little less and oily things little less, salt little less, and check it again. And if this is still more, your doctor will give you some antihypertensive. Nowadays they give lobetalol, very small 100 milligram tablet. She may give you alternate day initially because it's just a borderline. But if you have a urine albumin, she will definitely give you. If urine albumin is not there, she may repeat it after 7 to 10 days. And if it is still more, then the medicine is required and it will help you, not harm you. Yummy mummy, I faced IUD in 35 weeks on 2nd January. It was a second C-section. I faced high BP on that particular date and had GDM in my both pregnancy. When can I try? See, first baby is normal, Yummy. I think, Yummy, I think your first baby is normal. You lost the second baby. Now, first of all, now I would say nothing for next 1 year. Don't do anything because 2 cesarean sections you have got. 1 or 2, it's best to have 1 or 2 years. But in these 2 years, you promise yourself that you will control your weight, you will control your BP, you will become a marathon runner like me. I'm 65, I'm a marathon runner and I feel very nice at this age also. So today morning I ran so much, I'm so happy. I'll go and see my patients and come back at 9 and I'll cook for baby and I'll do a pratna. We do a bhajan sessions every day evening. I'm a Chitrapur Saraswat Brahmin, so we have bhajan sessions and still I'm fine. So if you do exercise, your GDM will not come, your BP will not come, and you're not next day. But because you've got 2 cesarean sections, wait for 2 years minimum, 2 years. 2 years because 2 cesarean sections, right? So 2 years. And do good exercise and be very, control your weight. Your BMI, body mass index, is weight upon height square. Weight in kg upon height in meter square. And your BMI should be less than 28. ऐसा करने की कोशिश कर. I have completed 8 months pregnancy. Doctor telling that the blood flow is not appropriate to the baby. So then what should I do in this case? See, first of all, 8 months, I do not know exactly how many you meet. Is it 32 weeks? Then in that case, wait. Doctor will give you Delispin injection. She may give you low molecular weight heparin and she may give you arginine containing sachet or something. With that, drink lot of water and keep a close watch. Every 4th or 5th day, she will check it. You understand? And check it with the maybe a good sonologist and see the color Doppler. I think with this you should go for another, at least try to cross 34 weeks, and you'll be having, she'll give you steroids, and then she still baby is having problems in delivery. But I do not think you should worry at all. But do these things. Vidya, I'm 5 weeks pregnant, and when should I visit doctor? Since it's lockdown, I'm not sure what it is. See, do your pregnancy test. If you have okay, you can take a folvite karke tablet. You can start and drink lot of take lots of fruits and vegetables and be happy. कुछ नहीं करना, दूध वगैरह पीना अच्छी तरह, ऐश करो, मूवी भी नेटफ्लिक्स में गंदे मूवीज मत देखो, अच्छे वाले मूवीज देखो, थोड़ा सा योगा करो, थोड़ा सा प्राणायाम करो, थोड़ा सा अच्छा खाना, और जब खुलेगा तब डॉक्टर के पास जाना, कुछ जरूर नहीं अभी इतने जल्दी जाने की, और 15 दिन के बाद नो प्रॉब्लम.
Thank you so much, madam. It's 7 o'clock. As you said, I mean, 6 to 7, we had a wonderful session. So still there are like around 15, 20 questions. There are more people want to know from you in this wonderful and join this wonderful session.
Next week I'll give again.
Sure, madam. Sure. Thank you so
week
much.
I'll give another topic. I'll teach, and then I'll take the questions.
So everyone, please post in the comments that we want to have Dr. Purnima ji again, so that we'll request her again and have a session. So thank you so much, madam, for the wonderful answers and sharing your personal experience, and also encouraging us all to have physically active and have a healthy lifestyle. Thank you so much for joining us, madam. It's a pleasure having you.
Thank you all. Thank you all. I feel like becoming pregnant again. I felt like I went through all my stages of labor. I've got 3 children. All are 3 big. They all are doctors, and their partners are also doctors. इतनी बुड्ढी हो गई हूँ मैं, लेकिन मैं बुड्ढी बनती नहीं हूँ. चलो, bye. Have a nice and safe delivery, all of you.
Yeah. Have a great day, everyone. Thank you so much. Thank you so much, madam, for joining.
Okay, I'll leave studio now.